Hi everyone, Dr. Cheryl Carthouse here. I'm going to do a short video on showing you how to draw up the saline solution for the nasal spray that we're going to have here. So when you first get your package, it'll have a bag like this in it. It'll already be sealed. It is sterile. It doesn't need to be for the nasal spray. You're just going to open it up by pulling pretty hard on the plastic there. And you can just throw that away or recycle it best. And then you're going to take your needle and your syringe, and we're going to put those together. So again, these are both sterile, but they don't need to be. We're just drawing up the saline solution, and your nose is not a sterile environment, so they don't need to stay sterile. In order to put them together, what we're going to do, get rid of that packaging there, is to actually just put them on and twist. And when you need to uncover the needle, you just pull. If you do, for whatever reason, happen to pull and twist at the same time, it is possible that the needle will come off. No problem at all. Just twist it back on and then just pull straight to get the needle off. Now when you're getting the saline out, you're going to look into this little rubber tube there, and there's a little center dot right in the middle. That's what you're going to aim for with your needle. So we're going to poke directly into that center needle and poke through. It will actually stay attached. So here you can actually let go. Often what I'll do is put it on a table so it's on an angle so the air bubble in the bag stays at the top. You don't want the air bubble coming towards the needle because you're going to be drawing up air then instead of water or instead of the saline solution. So if you can put it on a table, either resting just right on the edge or even prop it up on a book or something like that so that it stays on the edge, you can use one hand or two to draw back about 10 milliliters of the saline solution. And the syringe that you would have gotten is going to be a 10 mil syringe. So you can just pull right back all the way. If you get a little bit more, that's not a problem, or you can be exact. You want the top of the black rubber stopper to be at the number 10. And once that's full, you just pull it straight out. When you are inserting it, if you do have trouble, it feels like it gets stuck in the rubber, just take it away, pull it out, and then just try to aim it again right in that middle circle. When you push it into that circle, it will go fairly smoothly. If you get it stuck in the rubber around that, it might just be a bit thicker, and so you're going to have to push quite a bit harder to try and get it through. And sometimes you can actually still poke through the side of it. So just aim straight and there'll be no problem. Then you're going to take your bottle. Just point the needle down into it. Be very cautious not to poke yourself. Always best to rest this on a table and just use one hand, so this hand would actually not be here. And then you can point the needle into it, and you just push the syringe in it completely. And then just depending on the size of your bottle, it's either going to be a 10 mil, possibly a 20 mil, in which case you might want to be filling this up twice. Depending on what the recommendations are from your doctor. So you always want to make sure to put the needle head back on. The best way to do this is that if it is, the lid here is laying on a flat surface. Ooh, let's see if we can actually do this. If the lid here is laying on a flat surface, again, this hand would not be there, just laying on a flat surface. Just take one hand and slide it towards the lid, and then push it in, lift the lid up, and then you can use a hand to actually snap that back on, and you'll just avoid all needle pokes when there is no hand in the vicinity of the needle in the direction that it's going. That is the whole thing. Thank you. Let me know if you have any questions.